But I have counterparts in state government that are doing the same thing related to education, workforce, and sharing services at the state and local level to be more efficient. So in each case, it is get folks who maybe aren't used to working together in a room around a common topic and see how individually we don't have enough resources, but maybe in combination, we can figure out how to get some of this working. And again, all of our individual agencies then, their assignment is to target hotspots and align their programs to support these transformational initiatives. That's how we're functioning in terms of state government. I've worked with several state governments. I was in Congress for a while. It is the most exciting way to work that I've ever seen. I mean, it really is. It's fresh. It's fun. It's friends working together. I mean, it really is. There is a real spirit of innovation that's occurring. The thing I want to focus on in a little more detail with you is the one aspect of this related to health transformation. There is a lot on here. I'm thinking that most of you, though, by now have seen this probably 5 or 6 times. So maybe it's not so daunting. Every time I come out, I bring this. We've been working from this strategic plan from the beginning of the administration. And the content has not changed that much. But you can see some dates there. We initiated Medicaid modernization in 2011, and that was our first focus. And then last year we moved on to streamlining health and human services, and now we're fully engaged in a track we call paying for value. So over time, we knew we couldn't take it on all at once. We were fairly disciplined in how we came at it. I want to walk through each of these with you a little bit, starting with this first track on modernizing Medicaid. Many of you have been the key to success in this area. And again, a few people are complicated. How do we coordinate better? Almost everything on that list relates to that. Medicare and Medicaid are separate benefits. What if we brought those benefits together and coordinated as one? We have a Medicare, Medicaid dual eligible project to do that. We're one of only a few states that have that. Behavioral health is often very separate from physical health. Why not bring those together? We're working on the concept of a health home for people with severe and persistent mental illness. So right down the list, the idea is with our own Medicaid program, how do we think about coordinating better? We rebid our entire Medicaid managed care program from a lot of complicated regions into 3. As it turned out, the same plans, one each region, so we now have 5 health plans serving the entire state of Ohio. That was so much more efficient. We were able to mandate growth in those plans not exceed 3% a year. Something that is very rare for government to accomplish. When we came into office, Medicaid was growing 8.9% a year. It had grown that at that rate in the 3 prior years. Last year it grew less than 3%. So there are things you can do that don't cut benefits, don't take people off the program, but create efficiencies that let you create a more sustainable program. So that's modernizing Medicaid. The first item there, extend Medicaid coverage. For the longest time, I had a little coming soon next to that one. But a couple of weeks ago, we were successful, and we extended Medicaid coverage through the controlling board. I usually don't use these pictures, but I wanted to share a couple of them. This is what it was like. This picture, you won't know all these folks, but the governor's legislative director, the controlling board president, the governor's policy director, the governor's chief counsel, the governor's chief of staff, the Medicaid director, myself, the budget director, all in a room together. And we did this at 8:30 a.m. every morning for 2 months, literally every morning. We weren't all in the room. Sometimes it was by phone. But it was the governor's top priority for a sustained period of time. And it took this level of activity, I think, to get it done. This is the actual hearing. That's John McCarthy, best Medicaid director in the country. John is a practical, diligent, well-informed Medicaid director, and you cannot bluff him. He will call any bluff with providers, I'm sorry, but he's very good at what he does. So I was very glad that it was John who made the case to the controlling board, and then there's the piece of paper where 5 people signed that piece of paper, which is what was required to extend Medicaid coverage in Ohio. Thank you, John. The first to clap was Ohio's former Medicaid director. Thank you, John. And one thing about that piece of paper that it was really important to the governor. There's been some discussion, about how the governor somehow subverted the legislative process and got around it. But just a few days after the controlling board approved this, the Speaker of the House said, there was a majority of legislators in the House and Senate that supported this. And we believed that all along. We believed that what went wrong was that Medicaid expansion was not allowed to come up for a vote. So we saw the controlling board as a strategy to actually correct something that had gone wrong in the representative process. This is a microcosm of this broader political circumstance that's occurring, where a lot of what normally happens in the majority is being captured by kind of a very far right or a very far left element. Recently in the government shutdown, the far right, where a minority view is being amplified in a way that it distorts where people really are. And we were able to work through that by using the controlling board. It concerns me that that's not always available as an option. I think there's something really serious we're going to have to come to terms with in how our representative bodies are functioning right now. But that is perhaps another lecture. So next, streamlining health and human services. So they're very aggressive Medicaid agenda. Streamlining health and human services, as we were doing some of this work, we were realizing that often how we were organized was working against us. Mental health and addiction services were separate, so we consolidated them. Medicaid was a division down under another agency, so we elevated it. So this I think of as kind of our internal housekeeping. Technology infrastructure. And again, there's a parallel to what providers, counties, whoever you are, you deal with this too. Modernized Medicaid is get your policy right. Streamline health and human services is get your infrastructure right. And how do you get that working for you, not against you? There's one piece of this that I wanted to focus on a second, and I'm going to dazzle you with another chart. This one, if you can come back to on our website, may be very helpful to you. This explains why there is currently a raging debate about does the federal health insurance exchange work or not, and how do states connect to it or not. So the idea here is that currently all we had was that left-hand column, an Ohio client registry information system that was 32 years old and 60% of the time got the answer wrong, are you eligible for a program? Because it was designed at a time that as policies changed, those policies couldn't be incorporated into the automated system. So county caseworkers would have to intervene to override the system to get it to give the right answer. County by county by county. These programs are supposed to be consistent across counties. Well, what if those overrides are working a little different in one county versus another? Very inefficient. So the idea is you get rid of that system and you replace it with something that in real time can determine eligibility based on income. So now think about that. You don't have to go to the county office. You can go online to check to see if based on your income you're eligible for Medicaid. You could do that at home, or think about this. As you arrive at the hospital without coverage, at that moment, the hospital can say, you know, let's go on this website to see if you're eligible and do your application on the spot. Transformational. So now, we brought online October 1, the middle tier. BenefitsOhio.gov is now an online portal where folks can go. For a while, if they're eligible under our current rules, we still have to use the old system. We're transferring the old system to the new system. But for the new coverage group, and starting in January for kids and parents, they'll be able to do their application online through our new Ohio Integrated Eligibility System. Now here's where it gets complicated. To verify your income, we query a federal hub that checks IRS, Homeland Security, all of their databases to verify you are who you say you are and what is your income. We don't actually receive that information. They just verify that, yes, this person has an income at that level. For our system to work, the federal system has to work. And it's currently not working well. So that's how what we do is tied into this question of when can the federal system come online. And then their system is there on the right, healthcare.gov, the Federal Health Insurance Exchange. If they have somebody who they think is eligible for Medicaid, they don't just refer them, they actually transfer the data to us. And if we find somebody who's not eligible for Medicaid, but they should be on the exchange, we transfer their data to them. That transfer can't happen because the federal system